Hi, I wanted to welcome y'all to Arrowhead's meeting, our monthly meeting, mandatory paycheck payday meeting. We have our guest speaker today, Dr. Wright. Very proud to have him come. He is our medical director. Dr. Wright has been practicing in Riverdale in internal medicine for 24 years. He graduated from Morehouse School of Medicine last year. Yay! So I just wanted to thank him and let us let's let him give us some knowledge that we all need, that because he knows a lot about COVID. He helped us overcome it in the building. I think he really worked with us very closely. Okay.
Thank you, Lisa. So I'm going to try to be very brief so we can get in questions. As we all know, we've been going through a pandemic for the last year and a half, and so much information has come out and so much misconception and things have come out until we don't really, people are trying to figure out what should I follow, what should I believe. For me, in my practice, I've been mainly following the CDC guidelines and just kind of following the amount of people that have been vaccinated, the amount of people that have been, the percentage. So I'm just going to share with you guys. I don't know if people know this, but percentage for the US alone, over 300 million people have been vaccinated. Fully vaccinated about 140 something million. So that gives us about 44% of fully vaccinated people in the US, which is pretty good. By states, I think California is leading, Pennsylvania is way up there, New York is way up there as far as percentage of people that got vaccinated. As we know, there were two major ones out there, Pfizer and Moderna. For myself, I received the Moderna way back in, I think, January or February. I received both doses. Most of my patients were asking me, well, as soon as they come in, they would tell me, hey, I got the vaccine. Did you get yours, doc? And I said, hey, I had mine many months ago, many blue moons ago. So for me, the only thing I had was just a little bit of soreness in my arm, for which I took some Tylenol and it was fine. I didn't have any symptoms, any fever, any body aches or any sick feelings of malaise or anything like that. So that's the most common question I get from patients. Number one, did you take your vaccine? Number two, what should I expect from it? Number three, is it safe? So as we know, both the Pfizer and the Moderna, they have about in the high 90s effective rate, safety. I know we've heard some things about the Johnson & Johnson, so patients are kind of straying away from the Johnson & Johnson because of the threat of blood clots and all of that. But as far as, I'm concerned, it's a safe vaccine. It's been out. As you can tell, millions of people have received it. We haven't had, I think there was a study that showed out of the people that were vaccinated, about 3,000. So out of 50 million, only about 3,000 had some things where they were hospitalized or where someone actually died. But it wasn't, there was a whole bunch of factors that was involved. It wasn't the vaccine per se that caused that. I was just trying to think of some common questions I get asked from patients. My family members, all of my immediate household, everybody's been vaccinated. My 13-year-old is about to get vaccinated. But I have an 18-year-old, he's been vaccinated. He's all away in college. My wife has been vaccinated, myself. So I feel very strongly about it because, number one, I want to get back to normal where we used to be. And that's the new guidelines now, where if you've had the vaccine, you can pretty much function like you did before the pandemic happened, provided that it's okay with the federal, the state, and the local regulations. Now, there are some businesses that tell you, hey, we still want you to wear a mask, we still want you to do this. So we have to follow that if that business or in your particular state or your particular locale, if they tell you, hey, we want you to do it a certain way, even though you've been vaccinated, you still have to do it. I'll give you a personal example. I was in a Verizon store the other day getting my son a new phone, and this guy comes in, he said, hey, He told the lady at the front, she was like, sir, do you have a mask? He's like, no, I've been fully vaccinated. She's like, well, our policy is you still have to wear a mask. So you have to respect what people say, what the companies say. So for me, that's pretty much it. I'm welcome to take questions at this point, if anybody has any. Okay.
Hello, Dr. Wright. It's always a pleasure to see you again. Aside from the common side effects, like the soreness at the injection site and a little fatigue, are there any other common or maybe not so common side effects of the vaccine?
Well, some people complain of having swollen lymph nodes on that particular side where they get the vaccine done at. That was one of the most common, but the most common one are what you mentioned, feeling of fatigue, sickness, almost like you have the flu, that achy feeling, body aches, fatigue. Some people get fever. The soreness is another one. But some people will get like swollen lymph nodes on that side, almost as if you had an infection on that side. But that's your body's way of reacting to the vaccine.
Thank you.
Hi, Dr. Wright. Is it true that the vaccine has small nanobots that can track you in it?
No, there has been no evidence to show that it has any nanobots or in it. The vaccine is made from mRNA, which is a component that they took from the actual virus to put in there to make the vaccine. So what that does is once it's injected inside your body, as you know, the immune response is anything foreign comes into your body forms antibodies or proteins to help recognize it for later dates or to help fight it off. And so once your body does that, it actually destroys the mRNA from the vaccine in there. So there hasn't been any evidence. I know a lot of people, I read a lot of stuff because I like reading different opinions and different things. I read a lot of stuff about that. I've read about, oh, they're going to track you with the virus. It's going to cause infertility and all that stuff. But there hasn't been any evidence to support that. Mm-hmm.
Hey, Dr. Wright, how you doing?
Hey, Anita.
How do we know if the COVID vaccine is safe?
Well, I mean, we have to follow science. And what I generally tell my patients is that, hey, from all of the studies and all the things that we know, it's a safety profile from all the trials and stuff. There's a particular safety profile. Now, I often go back to the flu shot. The flu shot is one of those things that, hey, we've been getting it for years and it's been shown to be safe. And over, as far as you know, there hasn't been anybody dying from the flu shot or the flu vaccine. So the same thing with the COVID vaccine, where the trials have been done, it's been shown to be safe. Now, nothing is 100%, and I always caution people about that because sometimes I get the question, if I get the vaccine, am I totally protected against getting coronavirus? And the answer is no. There's nothing that's 100%. You know, there's still a small chance that you may contract the coronavirus, but it's very, very low. Your chances of, if I had an option to take it versus not take it, I would take it to keep the virus from coming on versus not taking it. Okay, so, but yeah.
Okay, thank you.
Okay. Hi.
Someone already has COVID-19 and has the antibody.
Mm-hmm.
Does that mean I would not need to have the vaccine?
No, actually you would. You would still need to get the vaccine. And actually the studies have shown that people who have already had the infection and take the vaccine, you probably won't need a booster shot. I know you've been hearing them talk about booster shots. So they're saying that people that already had the infection and on top of that, take the vaccine, you still need the vaccine in order to ensure your immunity. Okay?
Okay, thank you.
Hey, Dr. Wright.
Hey.
So my question is, so for women who are pregnant or considering getting pregnant, would you consider the vaccine or those considering getting pregnant get the vaccine? And do you think it infers the infertility?
That's that's another thing that I've heard a lot out there. Like I was telling her about the nanobites and all that. There's been no proven evidence to show that it's causing infertility. And I would tell any woman that's pregnant or planning to get pregnant, you're probably better off getting the vaccine. I would suggest you getting the vaccine anyway. Okay, because there's no evidence out there to prove it. All we have to go on is what the evidence shows. I mean, and like I keep saying, there's not 100% of anything. I mean, and one thing I tell people too, getting back to the nanobites, people say, well, they're trying to track us. I say, listen, since we were a kid all the way up to now, we've had millions of vaccines. If they wanted to track you, they could have done it before now while you was a little kid. They could have, I mean, we've had MMR, measles, rubella, we've had chickenpox vaccines, all this stuff. So if they wanted to track you, they could have been tracking you. So that kind of dispels that myth. Okay. Good. I'm good. Angie, hey Angie.
How you doing? What about people want to wait to get it at my doctor's office?
Well, the thing about it is, me per se, I don't offer it at my office. There are only designated sites like pharmacies like Walgreens, CVS, places like that. Now we were doing it a lot at this facility and we were doing it at the hospital. So most doctor's offices, as I know, they probably would not have the vaccine. There are designated vaccine sites that you would need to go to. So I wouldn't wait. If I wanted to do it, I would probably reach out to one of those places. Most places, like I say, like CVS, Walgreens, I think Kroger was doing it, and also Walmart, I think they were doing it as well. Some may be doing it, but most of the guys that I've talked to, they're not doing it at their office. Yeah. Yes, ma'am. Hey.
Hey, Dr. Wright.
Hello.
My question is, some of the residents they already received the Pfizer, somewhere they have one dose, and it's past like 2-3 months that we receive the second dose. What is your advice for the opportunity to give them to start all over again? Well,
from what I've read is about that, I get that question a lot too. If you've had the first dose, then you miss your second dose. You should get, as soon as you can get the chance to get the second dose, go ahead and get it, okay? Because what happens is, once you get the first dose, your immunity starts in about 12 days, but they don't know how long that immunity lasts. So you need that second dose in order to ensure your immunity. So if they've had the Pfizer and they come in and say, hey, it's been a couple of months, go ahead and give them that second dose. Even though they've already had the first, they don't need to start over, just give them that dose and then the second dose. I mean, with the second dose. You see what I'm saying? Yeah. So hopefully this was informative to you guys and helped to kind of set your mind at ease. I understand, and I tell patients all the time, I said, I understand your concerns. I understand your reservations about the vaccine. It's something new. It was kind of like 2019 and 2020, we're like, oh my God, what is going on? It was so much that happened so fast. So I could understand what people are talking about. But like I tell them, we have to follow the science. We've been following the science for all these years. We got to continue to follow the science and just follow the recommendation of the experts.